Hi, I'm Dr. Michael Calderwood, Chief Quality Officer at Dartmouth-Hitchcock Medical Center. I wanted to come today to talk a little bit about COVID-19, and we're in a much better place than we've been in recent months. I wanted to give some updates on where things stand, where they're going, and how you can continue to keep yourself healthy and safe as we enter into a new period of this pandemic. Over the past 2 weeks, New Hampshire has been averaging around 114 new cases per day. This is actually a 97% reduction from the peak that we reached in mid-January. In Vermont, there are now fewer than 100 cases per day on average over the past week. If we look across our state for hospitalizations, we are down to only 36 patients hospitalized in the state of New Hampshire. This is a 92% reduction from our peak in mid-December or early December. And you'll see in Vermont, we're down to 17 patients hospitalized across the state. Similarly, the number of people coming in to be tested has been on the decline. Right now, about 3% of individuals being tested are testing positive. At its peak, that was 26%. And so this is a vast improvement. And finally, just this past week, every county in the state of New Hampshire was shown to be green, meaning a low level of community transmission on the CDC maps. And while Vermont currently has all counties in a medium level of community transmission, except for Rutland, which remains at a high level of community transmission, we expect in the weeks ahead that they will be heading towards that green low level as well. If we look ahead, the projections really do look positive. We think that we are going to reach a point where we continue with low level activity of this virus. There will likely be a period where you see an increase in respiratory viruses, not just COVID, but things like influenza, as people begin to remove their masks, go out into large gatherings. That is to be expected. Now, having said that, this is what we describe as an endemic. So we expect COVID-19 to reach a period where it is always present. It is around us, but we have ways of protecting ourselves. We have vaccines that are incredibly protective against hospitalization and severe illness. For those who have breakthrough infections despite being vaccinated or being unvaccinated, we have medications. We have medications you can take by mouth. We have monoclonal antibodies that you can be given intravenously or intramuscularly. So we are in a much different state than we were a year ago. Other things to mention about this kind of endemic phase. We have many viruses that are endemic, and we want to think about what do we do to prevent them. A big thing about this is thinking about when we are sick, how can we make sure we're not spreading illness to other people? So as you begin to think about businesses and schools that are shifting to a period where they're not going to require masks, remember that the line is actually masks welcome. If you are feeling ill, first and foremost, think about, can you stay home? Can you recover? This has always been the case even before COVID-19. But if you need to go out, a mask is one way that you can help and make sure you're protecting others who are around you. We are going to begin to see individuals who have different levels of comfort. As we shift to fewer and fewer people wearing masks, you will see those in the community who continue to wear them, either because they themselves may be more susceptible to COVID-19 and severe illness from this virus, or because they have others at home who they're trying to protect, who may be more susceptible to severe illness. We ask that you have kindness and you realize that people are going to be at different points of comfort in terms of removing that mask. We have been facing this pandemic now for 2 years, and the mask has been a critical part of what we have done to prevent the spread of illness in our communities. Some are looking to toss that mask aside, and we are thankfully getting to a point where we can have those conversations. There are going to be some businesses that are asking people to wear them, and oftentimes the conversation is wear a mask when people around you are asking you to do it. The laws will change. What is required in different communities will be different. The general thing is keep a mask in your pocket. Have it on you in case those are asking you to put it on. And remember that it is easy to wear a mask, and it is something that has kept us safe for quite a long time. So what can you do? We are at a point where you're going to go into the spring and you're going to see large gatherings. You're going to see theaters and shows and sports events. This is an exciting time where we are able to get back to doing many of the things we were able to do in the past. And we will watch the numbers closely. What we're going to focus on right now is looking at the number of individuals who are hospitalized and looking at the number of beds in those hospitals that are staffed. Right now, we are in a very good spot. Dartmouth-Hitchcock Medical Center, hospitals in Dartmouth-Hitchcock Health as the system are really working to catch up with all of the non-COVID care that had to be delayed during this pandemic. We will watch that closely. We don't have any indication that the numbers will increase, but that will be communicated to the community, and you will see this reflected in many of the community maps the CDC is releasing every week. You will not, however, in many instances, see us reporting how many cases are in the community. We're going to kind of move away from that as we do with many other things that are circulating in the community. It's because those numbers may not be accurate. We know many individuals are testing at home and using home-based testing to really think about, am I sick? Am I going to put others at risk? And knowing that at-home test result can help people to make their choices about should they go to that gathering, should they think about staying home from work. Not all those get reported, and that's why we don't think the community numbers are as reflective of where things stand as the local hospital numbers. I will also remind folks that we have a large availability of vaccines for those who have had 2 shots of the mRNA vaccine. I remind you that the booster is available as a 3rd shot. For those who had 3 shots as a primary series because of an impaired immune system, I remind you that the booster is actually a 4th shot. And so some people may require 4 rather than 3, depending on their underlying illness. I'll also remind folks that increasingly you will see the therapies available in pharmacies and available from primary care offices. And so please be watching us at dh.org to understand where you can get access to therapeutics as they become available and where they are in your community. Thank you very much.